bowed tendon is, first off, you need to know where it's located. This is the front limb of a horse, and externally on the outside here, we're looking in this area right here. This is the tendon, the deep and superficial flexor tendon right here running down the back of the limb. Okay. Now internally, what we see is this structure right here. The red is the superficial flexor tendon, and where it goes down here attaches along the pastern. And the yellow on the inside is the deep flexor tendon. Typically, it goes all the way down the back here, originates out of the forearm or the radius of the horse, and it goes all the way down and attaches down here at the base of the coffin bone. And its action is to flex the entire lower limb and pull it backwards, okay, on flexion. Superficial does the same thing, except it doesn't attach nearly as far down. It attaches along the pastern. So, what we see is that throughout cyclic concussion, or throughout many repetitive cycles on extension and bearing weight and bringing the limb back forward, what ends up happening is that this tendon structure, mainly the superficial, gets overstretched. And when it gets overstretched, it essentially loses some of its shape and creates some hemorrhage and edema in it. What we call a bowed tendon is the external clinical symptoms of enlargement of mainly the superficial and or the deep flexor tendon. And that is clinically what a bowed tendon is. One of the behavioral signs of a bowed tendon is lameness. They typically will, when they're extremely bowed, they are extremely lame. They will limp, they will nod, and they will show you that there is a tremendous gait deficit associated with the injury of an acute bowed tendon. And the reason why is because it creates quite a bit of pain on extension of the limb when they go to place it on extension. And these fibers shorten up quite a bit, and of course it's enlarged and it's inflamed and sore and hot and visually, palpably, just uncomfortable to them. And clinically, they, like I said, it creates a tremendous amount of discomfort to them. So therefore, they are lame. The reason we call it a bow is because it gets a big round. The large, really extremely obvious bowed tendons are really enlargements of this belly of a large area, from usually right up behind the knee, right here, the carpus, to down sometimes as far as the fetlock. And this is what they call a large bow.
And you mentioned the discomfort. What are the major complications that can arise from bowed tendons?
Well, lack of use. The major complications that occur due to a bowed tendon are obviously a lack of function of the limb, lack of extension of the limb, a lameness, so therefore lack of performance or lack of ability to perform, and essentially loss of use.
Okay, we're gonna lead into broken bones in the leg area.
Okay.